Bismillahirrahmanirrahim. Assalamu alaikum. Okay, so today we are going to talk about analgesics. What are analgesics? Basically, the term analgesia is derived from the word algesia, meaning pain. Pain is an unpleasant, uncomfortable, or noxious sensation localized to the part of the body. It is frequently described a tissue destructive process, for example, in case of inflammation, either acute or chronic, with infection maybe, or stabbing, burning, or any mechanical injury of the tissue. Analgesia means the inability to feel pain. And analgesics are the drugs that relieve pain without the loss of remaining sensation and loss of consciousness. You should know that the improvement of pain depends on its type, characteristics, and different therapies are effective. Pain may be acute or chronic. Acute pain, for example, with any present inflammation, infection, stabbing, burning, as I told, or post-operational wounds. While the chronic pain may occur in different conditions like fibromyalgia, a condition that causes pain all over the body, maybe due to some physical stress or emotional, psychological stress, neuropathy, neuropathic pain, and other chronic headaches, for example, migraine, tension headaches, chronic backache, and pain due to cancer. So these are the examples of chronic pains. Pain can take up a different form depending on its intensity. For example, it can appear in the form of burning sensation, or it can be sharp, aching, dull, stabbing, sometimes radiating pains, throbbing, for example, throbbing headache, cramping, and shootings. In case of trigeminal neuralgia, very excruciating pain, shooting in nature. So we can have different clinical approaches to analgesia. First, with non-narcotic analgesics. These drugs generally relieve the mild to moderate pains like headache and pain due to inflammation. They include mostly non-steroidal anti-inflammatory drugs like aspirin, ibuprofen, and diclofenac sodium. Secondly, we can use narcotic analgesics used for severe visceral, post-operational, sometimes sharp or very intense pain, intermittent pain, or some chronic malignant pains. Opioid drugs like morphine we are using, and these kind of drug can relieve the pain with induced drowsiness. Okay, in third category, we can use drug in chronic pains, for example, neuropathic pain. These kind of drugs belong to the central nervous system of pharmacology. And we can use antidepressant drug like tricyclic antidepressant amitriptyline, or sometimes serotonin, norepinephrine reuptake inhibitors, duloxetine. And sometimes we are using anticonvulsant in low doses like pregabalin. Inshallah, in my next video, I will tell you about the non-steroidal anti-inflammatory drugs in detail. Detail के साथ discuss करेंगे next video में. Have a nice day and thank you for watching. Assalamu alaikum.